This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Healthwatch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Healthwatch, and your host, John Damazzi.
Good morning. Welcome to the show. Always a pleasure to have you with us as we get together for our Sunday morning gathering here at the
beautiful Bella.
Beautiful downtown Atlantic City at the Bella. That's right. Dr. Molly Fantasia is here, as you heard the man say. She is, of course, the PhD doctor, executive director, and founder of Innovative Medical Associates, located in Marlton, New Jersey. And, of course, Dr. Molly is here and ready to talk to you and give us some information about the who, what, when, where, why, and how of Innovative Medical Associates.
John, I always feel like you're teaching journalism 101.
That's right.
Right when we start, which I love. Yeah.
That's right. Well, listen, I went through it, so...
I hear you, and you're teaching all of us, including me. Thank
exactly.
you.
So, we have plenty to talk about here on the show. A lot of new patients for Dr. Molly and Innovative Medical Associates, and we'll talk about some of their challenges and treatment protocols that Dr. Molly will be offering them. But if you have a question, 855-839-1210. That is the number here in the studio, 855-839-1210. And again, anytime you have a question or a thought for Dr. Molly, feel free to call in. She'll be happy to talk to you. Innovative Medical Associates, speaking of the who, what, when, where, why, and how.
Well, here we go. Okay, so you know that Innovative Medical Associates is a collaborative of healthcare providers that work out of Associates in Preventive Medicine's primary care facility. It always seems people are always a little confused when they come in. And I say there's nothing to be confused about. Just know that the real estate is mine. It means the facility belongs to me. And actually, the buck stops with Dr. Molly
That's
or
right.
whatever goes on
That's
in that
right.
facility. So we brought together a wonderful group of people who've all had health challenges of their own or have seen some health challenges that really did not get better using conventional treatment for primary care, which includes things like the pharmaceuticals. Or they were getting better, but then they suffered from the side effects of the pharmaceuticals. So the philosophy has been one of mine in this entire time, which means we use natural substances or God's ingredients to help utilize your possibly your pharmaceuticals in a way that we can cut the dosing and minimize the side effects.
And you were talking about side effects. You're right. People start to get a little better, and then they take the prescription.
Sure.
And in a couple of weeks, they feel
lousy, as they like to say to me.
Right.
And that may be true. The idea is what you have to do is I never tell you to get rid of your pharmaceuticals. We know that they can effectuate change for you depending on what we're taking them for. So, for example, if you have a raging infection, you're going to need an antibiotic in one form or another. The question is, can we give you some things that would help minimize the side effects of the antibiotic and even maybe help you get through the course of antibiotics with still some quality of life?
And in many cases, you try to wean them completely off.
If we can,
right?
if we can. But, that's a call that my docs make, including my wonderful medical director, Dr. Mark. And what we want to do is utilize the pharmaceutical when it's appropriate and then augment with functional medicine, which is exactly what we do or what I do.
All right, you deliver the IV. It's hydration.
It's hydration.
Right.
Hydration being the best vehicle.
Right.
For it.
And you were talking to a patient. You were saying, tell me before the show, that someone else suggested taking pills, taking it orally, and that's not. That's not the maximum, right?
Listen, forget maximum. It's appropriate. It's what we want to use as an appropriate dose. There's nothing like compounded dosing, which means compounding for the particular patient including the nutraceuticals. Okay, we all know what a course, let's say a course of a Z-Pack. We all know, right? You take 2, right? And why do you take 2? Because you want to get enough in, and then followed by a little lesser dose until the end of the pack. Well, the same thing is true with nutraceuticals. I might want to start you at one particular level and then move it around or join some other nutraceuticals in to intensify the outcome. And that's what we do. But I will tell you, natural substances, if you don't get the proper constituent, which means the ingredient in the natural substance, and an appropriate dose, you'll never get the change.
Talk about this because you've mentioned it before. Taking it via hydration versus orally.
A drop in the ocean.
Big difference, right?
When you take it orally, it's a drop in the ocean. When you take it through hydration, it's the ocean itself.
Right. It's a direct line, right?
Right.
So that's why you suggest that. If a person is coming in and they decide to begin treatment with you, we're talking about hydration.
Right.
How often do they come in?
Generally, at least once a week, at least for the first 5 weeks, and possibly twice. It really depends on what the patient's coming in for, John. You know how hard that is to say? It's like when you go in traditionally and you say, well, what's my protocol going to be? Well, I'm not sure till I see some lab results, till I see what else is going on. That's true with hydration too, but I will tell you this. Probably in the first 10 treatments, people start to feel the change. And by that, I mean their quality of life starts to improve. Then we really have to work on changing the metabolics, and that's the key.
I know with me, sometimes I feel differently in one treatment versus another, and I've often asked you that, and you said, well, I tweaked. I can tell when you tweak because
Sure.
I can tell how I feel.
Exactly.
You know?
Because sometimes I'm looking to slow you down, which is very difficult, as you know. And other times I just want to give you that high test boost because you need it. But it all depends. You know, when we come in with a multitude of challenges, one of the things I really love, people come to me with a whole list of their challenges, and they think I can do all that in the first treatment. That is not the case. I really have to give it some thought and be, fully present with it and say, okay, this is how we bite this apple, one bite at a time. And then we effectuate the change.
Talk about the fact that, we're talking hydration.
Right.
But people are very familiar with health food stores, and they're very familiar with all the things that they offer.
I love health food stores.
Do you recommend?
Sure, I do.
Supplementing?
Of course I do. We were talking just a little bit about CBD. It's hot.
Right,
it's everywhere.
right.
You can go to Rite Aid. You can go, you know what? I just saw we could go to the vape stores that are all around. They have CBD for you, too.
Yeah.
Well, the question is, what is the actual constituents that you're looking for in the CBD oil, which is the CBD itself, okay? And how much do you use? Well, that's where you need some advice, that kind of. And the other thing is, I'm telling you, most of the CBD that's out there that you can buy in jars, etc., are useless. And the reason being is I'm looking at the dosing of the particular oil.
Can you explain what CBD is? Because we hear that a lot.
CBD is cannabis, and cannabis is used, we're most familiar with it, us folks of the 60s. Come on, John, you're of the 60s too. Most of us in the 50s, 60s, and early 70s, we knew CBD as marijuana, but it's not medical grade marijuana. Used to get it wherever on college campuses, that kind of thing. What you want to do is you're looking for the hemp. You're looking for the actual CBD from the hemp. The cannabis oil is what you're looking for. That's hence CBD. That is the constituents that can affect change for people, like for pain, neurodegenerative, and we'll get into that a little later. But the question is, at what level is that CBD? And there's the question. Look at your jars, folks. See how many milligrams are in them, and then we'll talk. And I've been talking more and more about it because lots of my patients went out and got it all over. And by the way, it's not cheap, but they all go in and they get it, and you look at the low levels of the CBD, and I say, wow, how can that effectuate change? So I did the medical research, and now I have a game plan as to how high the CBD should be in a particular product to effectuate a change, whether it's pain or neurodegenerative or something else.
Which you have said is often the case with
Everything.
over-the-counter products.
Everything.
I mean, that the dosing is very minor.
Well, it's regulated probably by FDA. I'm sure that is too. I'm not sure, but I think it is. And, they're going to go low end because they don't want to have any side effects. Generally, with natural products, if used correctly, you won't have the kind of side effects that would be life-threatening. Okay,
we're going to talk more about that and other things here. It's coming up on our first break.
Wow.
Our show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210. WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and founder, Innovative Medical Associates, Marlton, New Jersey. I'm your host, John DeMasi. The number in the studio, 855-839-1210. We always tell you call early because we don't want you to get shut out. A lot of times people call in and we have 2 minutes to go on the show. So pretty hard to take your call at that point. 855-839-1210 is the number. We're coming back. More Health Watch after these words. Back here on Health Watch, as per usual, operators standing by at Innovative Medical Associates when we're on the show, and they'll be there after we leave you at 9 o'clock. The number is 856-489-0505. 856-489-0505. Innovative Medical Associates. You want to ask them any question, you want more information, or, most importantly, you want to sit down and make an appointment with Dr. Molly. That's what you do. You call them and set it up right now. And during the week, see a lot of people. When I'm in there, I see a lot do coming in for consultations.
Well, I really think they're coming in to see you, John.
Well, listen.
Come on. They don't let you have peace. I see that.
Well, that's for sure.
Are you John DeMasi?
Yeah, okay.
Yes.
Yeah, you're right. I try to sit there and but anyway. Also, our website and something that we've added new. There's a new page, and all I can tell you right now is it's innovativemedicalassociates.com, innovativemedicalassociates.com, and you'll see some products, and we'll talk about that in future shows. We're not quite ready yet, but it's there, so you can look at it and see, well, what's coming? Well, it's coming soon. So innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. And also do want to mention that today is the last Phillies game of the regular season. Hopefully they make the playoffs. But we are normally on in the afternoon, but due to the Phillies being on Talk Radio 1210, we will be on tonight with our Healthwatch Replay from 8 until 9. So if you are looking for us and you hear baseball, that's what the situation is. But next week we're back to our regular repeat play, okay? 855-839-1210 is the number, 855-839-1210. That's our number here in the studio here on Health Watch. Dr. Molly, a lot of new patients.
Yeah, and a lot of new patients with neurodegenerative diseases, which things like Parkinson's, MS, acute depression, or actually chronic depression, anxiety. I'm seeing a lot of anxiety. Now, I believe that some of this, in terms of the anxiety and the depression and those types of conditions, mood problems, I think have been brought on by the virus, and just how we've been feeling. But, I'm a member of environmental medicine. I got into the Academy of Environmental Medicine just recently. And it's interesting because the more studying I did in environmental medicine, the more I realized neurodegenerative diseases have many, many, many facets. So, when you go in and you say, well, I think I'm losing my memory. Well, immediately our minds go to things like what? Alzheimer's, dementia, things like that. But, it could be an environmental toxin that's causing this. So how does one deal with that? One deals with it by testing, doing a good clinical exam, possibly using some of the the actual study material that's out there that, you give a patient and say, tell me 3 words, that kind of deal, a mini neurotype exam. And you start to ask questions about what's going on in their life, and you find out about things like, could they potentially have mold? Could they potentially have some other things going on? Or have they truly been diagnosed with a chronic neurodegenerative disease, again, like Parkinson's, like MS? Well, looking at all of this, we find that the use of hydration is a way by which we can help these people. And one of the things that we use is what? Chelation, the thing I cut my teeth on. So it was a roundabout way for me to get back to my old protocols. And in a way, I have improved them. But fundamentally, the EDTA that we started with 24 years ago this week, remember, our facility, our protocols have been in place for 24 years as of this week. EDTA still really has a wonderful role in this because it is a chelator, which means to claw out. So one of the things we look at is what? Heavy metals. Heavy metals. Now, that's easy. You run heavy metal testing. You see where they fall. The question becomes, is the range of heavy metals appropriate? They make the bar so high that you say, well, the patient's normal in a normal blood test for heavy metals. Well, do you think that means something, that you're normal in a heavy metal testing? The answer to that is no. If you have traces of that metal, I would say there's a good chance you might have heavy metal problems in the brain tissue because it's systemic. So guess what? I still believe you chelate in those conditions. You remove the heavy metals. It improves blood flow head to toe 12%. So it doesn't just improve the vascular system, which is why people like functional medicines doctors used it in the beginning and then found that brain health improved. But you really do use the EDTA or other chelators like DMPS for mercury and some other things. So there are many chelators. By the way, vitamin C is a chelator, an antioxidant and a chelator.
Vitamin C does everything, right?
Yeah, vitamin C does. It's one of God's miracles, right? So there are many, many things. But in addition, exposure to fine particles. Do you know what I mean by that, Joan?
No, I mean fine particles.
Fine
I'm thinking
particles, okay? Particles, tiny particles in our air. So, for example, burning smoke, maybe myotoxins from fungus that are coming up. Small particles, tiny, I'm talking in micrograms, tinier than a gram, okay? Tinier than we measure on our measuring tapes, all right? They are so tiny, they end up going into the lungs, and the lungs, is our way of filter. Think of the lungs as our air filters, like in the car when we put on the air conditioning stuff.
Right.
Well, if they're so tiny, they get stuck in the cells that have like little ganglions. They look like little, I don't know how to put it. They're just little things that stick out on the cells that help move the air. And guess what? These tiny particles get stuck in there, end up in the cells of the lung, and then go through the blood system. So you don't think they end up in the brain? Sure they do. Sure they do. So here we go. This is something. They cause what? They cause inflation. We're back to our old friend. Inflammation. You know what? My mind right now is on a couple of things that's going on.
Right. Exactly.
Right.
I was going to say.
Inflammation.
This is not a financial show.
This isn't the financial show. So forgive me, folks, because I'm actually thinking about something else. But it definitely is inflammation. So here we go. And what does inflammation do? It causes damage. Well, inflation does too, but we're not talking about that.
Exactly right.
All right.
That's for other shows.
That's for other shows. Right. But so inflammation. So you see, it's sort of simple. So we have to chelate out this junk. So when you go for the CTs and everything, what are they doing? They're looking for plaquing. Yeah. Same thing.
Well, we're coming up shortly on a break, and I want to get to, speaking of how you cut your teeth, and chelation, I want to get to, you have some cardiac patients going to be starting.
Right now.
Yeah, and I want to talk about that. And also we have some breast cancer situations. So we're going to talk about those after the break. But I remember when you first started out and you and I first met, we were talking cardiac, we were talking a lot of things pertaining to chelation.
Right.
And I remember your late founding physician with the claw of the crab.
Absolutely.
And I always think about that because it said the crab is
right.
clawing it out.
That's right.
And so we will get to that in just a couple of minutes here on Health Watch. Again, 855-839-1210 is our number here. 855-839-1210. Plenty to talk about here on the show. Also, this is something we haven't talked about much. You want to talk about glaucoma.
Yes.
Later
I have a
on in the
patient
show.
with glaucoma.
Yeah,
yes.
so we're going to talk about that as well. Our show is Health Watch. We're here every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and executive director and founder of Innovative Medical Associates, Marlton, New Jersey. And I'm your host, John DeMasi. Again, the number, 855-839-1210. You have a question or comment for Dr. Molly, 855-839-1210. We return. More of today's version of Health Watch after these words. We are back on Health Watch, and as always, operators standing by at Innovative Medical Associates. 856-489-0505 is the number. 856-489-0505. You want to make an appointment to sit down with Dr. Molly. The initial consultation is complimentary, and like I said, I witnessed a few consultations the other day, people walking through the clinic and saying hello.
That's right.
And when I sign the first autograph, I'll let you know.
Oh,
Okay?
come on, John. You know it's that. I see it, man. You're the star. You're the star.
I'll let you know. But anyway, 856-489-0505 is the number. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And remember, we have our Health Watch replay, which normally is Sunday afternoon, but due to Phillies baseball, and it's the last game of the regular season, so we're on at 8 this evening, 8 till 9, our Health Watch replay. But next week, we're back to normal, so we'll tell you all about that next week. 855-839-1210 is the number here in the studio. If you want to ask Dr. Molly a question here on Health Watch, 855-839-1210. Dr. Molly, we were talking before the break about some cases, and I wanted to talk about cardiac because that was another one that you cut your teeth on way back when.
Absolutely. One of the things is very interesting. So I had a really nice family come in, a father and two sons. One of the sons actually has had a full series of chelation somewhere else. And he spoke to the doctor that he had it somewhere, I think, up in, near upstate or near Poconos in Pennsylvania. And he needed a place closer to his father, and the doctor recommended our clinic. So, it was interesting. He comes in with his dad, and he has his brother with him, and they all had problems. So I asked the gentleman who did have the chelation, well, so how you doing? Well, see, I didn't go back for maintenance. Whoa, you did 30 treatments and you didn't go back for maintenance. That's a big problem. Imagine that you come in once a week for 30 weeks, let's say, and you don't go back for maybe once a month or once every 6 weeks for the maintenance to help maintain what? The reserve.
Exactly. Doesn't make any sense.
Doesn't make any sense. But anyway, so he was smart enough to bring his dad, who's up there in age, who's on a ton of medication, obviously has some serious cardiac issues, and I am definitely going to put him on a course of EDTA chelation using also some cardiac nutrition. This is where we do things a little differently. We actually not just use the chelators, but then what we want to do is we want to actually re-nourish the heart as well as hold down the inflammation in the vessels and actually re-nourish the vital organs. So we're going to use D-ribose as well as the EDTA, of course, vitamin C, which is always used. We want to clean out the liver because all of the gentlemen are on statin drugs, and that has an effect on the liver. We want to claw out some of the lipids, the bad lipids. We're going to go through his all of their nutraceutical regime and reevaluate them.
Okay, we'll get back to that, but we're going to go to the phones. Maple Shade, New Jersey. Jonathan, good morning. You're on with Dr. Molly.
Good morning, Jonathan.
Good morning. Good morning. Always
how are you?
Enjoy hearing the show.
Oh, thank you. We enjoy you listening. We like your calls. Go ahead.
I have a simple question. What would you have for a senior that generally good health?
Good.
But you just might be able to maybe boost a little more energy, a little more brain focus, a little more.
Yes.
All around better longevity.
Sure.
No serious issues, no pills.
Good.
Not taking any
Thank God.
Pharmaceuticals.
Smart boy. Good.
What might you
NAD.
have for those kind of people?
NAD. Look that up just that way. NAD. I liken it to one of the fountains of youth. I would use NAD. I would use vitamin C. I would use glutathione, which then helps the liver. Alpha lipoic acid. I would want to see your or anyone's latest blood work if they had it. If not, we can order it as long as you have Medicare and general insurance. We can order it. That's covered. I would want to make sure kidney functions are okay. And I probably would want to sit down with my nurse, Barbara, and the patient and go through whatever regimen of nutraceuticals the senior is taking, because we may want to add some for the brain fog, that kind of thing. I might even test the senior's cortisol level, which I'd expect to be a little lower than someone who's in their 40s, 50s, or 60s, and then help them actually build the adrenals back up in a more natural way. So there's many things we can do, and I have many patients who come in just for that, sir. Many patients.
Oh, sounds good.
Yeah, come in for the free consultation. You sound like a very smart man. May I ask you a quick question? What nutraceuticals is the senior on? Because you don't sound like a senior guy.
Okay. Omega-3s.
Great. Good.
Barley grass juice powder.
Very good. Very good. Good.
Whey protein powder.
Whey, okay. Good.
Some vitamin C, vitamin D a lot.
Yes. Good. Sounds good.
That's kind of basically it.
Good.
Yeah.
Vitamin D is very, very important. It's also very important for brain health.
And I'm on that too.
Yeah, man. We believe in at least 5,000, and we would test that in the initial testing. So this is cool.
Right.
Jonathan,
Thank you, Jonathan.
feel free to call Dr. Molly
Yeah.
and go see her.
Thank you.
Thanks for the call.
Thank you. That was a nice call.
Yeah, the
Nice
initial
call.
consultation, of course, is complimentary. And
Absolutely.
speaking of nutraceuticals, your nurse, Barbara.
Yeah, she's the best.
I mean, you had done some blood work, and you said to me, look, you got some challenges. And she gave me a list, which is 2 pages long.
Yeah, but we don't expect you.
I know that, but I mean, it was so thorough.
Right.
She even had the phone number of the place to call with the brand that she wanted.
That's right. And I might add, we don't get a commission for that.
I know that.
want to really be. We have no financial interest in the particular vitamins that we recommend. And I think it's really important that people get on good brands. It'll make all the difference, and it goes hand in hand with the hydration. It does nothing but help us really get to the effect that we want.
Okay, we were talking about, by the way, the number 855-839-1210. We were talking about cardiac.
Right.
And we had also talked about neuro. Now, you had some breast cancer patient coming in?
Yes, I had a breast cancer patient. Actually, 2 sisters came in. Also, it felt like family week at Innovative. So I had 2 wonderful sisters who came in, and one of the sisters had a bout of breast cancer, and of course they want to do something to really help her immune system through this thing. She has had the surgery. She's not sure she wants to do radiation or chemo. And again, we don't press our patients. Whatever we meet the patient where they are. So in this case, I would use several things. I would use several of the homeopathics that I have from Germany and some from Italy. And see, the thing about the radio show is I can't always talk about what other nutraceuticals or homeopaths I would use. That's why it's really important for cancer patients to come in and sit and chat.
Because then you can tell them anything.
Then, well, not anything, but things that are appropriate for them.
Exactly.
And we do. And I want them to know that there are other things. I have a wonderful woman who had metastases to the brain. You know her.
Yes.
Polish gal, wonderful gal. She had her CT listing. I'm hitting that hard with several items from Germany. And she's doing well. It's staying steady. Did not grow. That's what we want to do. So the other sister's in fairly good shape. She has some pain management issues for, rheumatoid and those kinds of things. So her IVs will be different than the sister with cancer, obviously. But it's very interesting that they came in together because, again, I'm going to tell people after a certain age, what's the best gift you can give anybody? Their health.
Right. That's
their
right.
health. Otherwise, you don't enjoy anything. You don't enjoy. It doesn't matter. You can have the best cars. You can have the best vacation homes. You don't enjoy them if you can't get around.
Okay, we are coming up on our final break of the morning. Boy, the show's going fast today, huh?
It's great. It's great.
855-839-1210 is our number here. The show is Healthwatch. Every Sunday, 8 till 9, our live version here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the Ph.D. doctor and executive director and founder of Innovative Medical Associates, Marlton, New Jersey. And I'm your host, John DeMasi. Still have time for some calls if you want to jump in here at 855-839-1210. We're back with more Health Watch after these words. Welcome back to Health Watch. Operators standing by at Innovative Medical Associates right now. And remember, when we leave you at 9 o'clock, they don't leave. So, they stay. Dr. Molly says you stay.
Fabulous Fran better answer that
That's
phone.
right. 856-489-0505 is the number. 856-489-0505. That's the number today. It's the number tomorrow, during the week, whenever you call. 856-489-0505. Innovative Medical Associates. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. If you browse through the website, you'll see a lot of good information, and you'll see some new information about products, which it's a little early to talk more about it, but we will in future weeks.
But let's say you don't ingest these products,
yes.
Okay? Dr. Molly isn't doing like a vitamin
right.
product.
Okay. 856-489-0505 is the number. Don't forget our Healthwatch Replay. Special time today, 8 to 9 p.m. tonight here on Talk Radio 1210 WPHT. 8 p.m. tonight, and then next week we get back to our normal time. Got a couple minutes left of the show. If you want to jump in with a question, 855-839-1210 is our number in the studio, 855-839-1210. I wanted to talk about this glaucoma patient because rarely have you talked about that, and that's interesting and something different. Talk about that.
Yes. Well, here's the thing. She went to her eye doctor, and of course he told her there's nothing ever can be done about glaucoma. Now, I cannot say we reverse glaucoma. I'm not going to say that. However, there was a famous eye doctor out of Florida. His name was Condit, Kondt. And Dr. Condit wrote an entire book on vitamins and things for the eye. And he had a very interesting practice. And some of his patients had glaucoma. If you know, glaucoma is that pressure behind the eye. Well, would you think that the vessels in the eye are very, very small? So some of the first things I do when a patient presents with this is test for the heavy metals. Because if the patient doesn't have enough vascularization up there, meaning enough oxygen, how are they ever going to get better, okay, or see a little more? The idea is if you can help a patient get to at least 10 or 20% more with glaucoma, you've done a lot. And guess what? It really improves their quality of life, because if you see more, what happens is it really improves brain function as well.
Sure.
It's one of the things that we use to say, oh, we're feeling good in terms of our brain function. So one of the things that we do is we use EDTA along with some oxygen therapies, okay, along with lutein. Everybody knows the some macular vitamins, lutein, some herbal preparations that I use IV as well, including something called bicopa, which is an Indian herb. And really, we want to go through an entire list of vitamins with this patient. But again, I'm thinking very seriously of putting this patient on a biooxidative routine as well. And I have a call into one of my physician consultants about that kind of thing. So there is something we can do. And I think the worst thing a physician can do, we must tell the truth, okay? If there's no cure or no way to reverse the injury to the macula, that's the problem. It's not the glaucoma itself. It's the injury to the macular cells. Then we have to tell them the truth. However, we certainly can try to improve that.
You know, you have had many patients who have come to you, and the doctors have said to them, "Oh, really, nothing we can do," and you're not saying you can cure the problem, but you could at least give some relief,
possibly help her. I don't know for sure, but after reading this, and of course, not taking her off her glaucoma drugs. Okay, so there's part of that.
Let's talk to Donna in Ben Salem. Donna, good morning.
Hey,
You're
Donna.
on Health Watch with Dr. Molly.
Hey, Donna.
Hi, Dr. Molly. How are you?
I'm good. How are you?
I'm good. I have a question.
Sure.
My husband was diagnosed with the virus at the beginning of July.
Wow.
Yeah. He wasn't in the hospital.
Thank
was home.
God. Thank
Yeah.
God.
So just heavy fatigue and a slight cough. So he seems better now, but he did get a blood clot in his leg.
Oh, yeah. This is a very odd kind of thing. The blood clots have been recently, we're seeing more and more of that. Go ahead, dear.
So he was in the hospital for a couple days.
Okay.
And they put him on, he's on Eliquis right now.
Yes, good.
5 milligrams. The leg's still not, I mean, it's gone down,
right.
But it's still not right. So, and he has high blood pressure. Just that issue right there. But, he has his energy level back. But I'm just wondering if, you can help him maybe with his leg. And
I think
just
we can.
Maybe, yeah.
I absolutely think we can. What are you, hey, Donna, are you a nurse by any chance or anything? Are you a nurse?
No.
Oh, okay.
No, I'm actually a breast cancer survivor, and I'm thinking of coming in, too.
God bless you. Yes, come in. Let's come in for the free consult, both of you, and we'll do them. We'll do them back to back. But the interesting thing is, I think I can help him. We can help improve blood flow to those legs. That is extremely important, right? And I would also want to look at a couple of other things, like we know that the virus contributed to the blood clot, so we know that he doesn't usually have that, but the hypertension does worry me. We can get that blood pressure under control. Is he on a hypertensive med right now? Do you know, Donna?
Oh, yes. He's on 4 of them, and the doctor wanted to up it a little bit, so he's not happy about that either.
No. Come in. I think we can help him reduce that, but not too quickly, especially since he had the corona. I would really want to see him and see if we can work together with my docs and see if we can get him off a couple of those and keep it up. Also, did you say that he's still having a little cough there? A little cough?
No.
No? Good.
No
okay,
cough.
great.
No.
Great. Great.
And I'm so surprised that, he had it and then I didn't get it. I mean, I was with him
let's
every
thank
second.
God. Thank God.
I know,
but you know what? Have you been tested for the antibodies or anything? Have you been tested?
No.
Well, it might be something that you want to do, which we probably can do at our place. But you want to think about yourself. Since you're a breast cancer survivor, how long since the active breast cancer?
Since 2008.
Great.
2008
Thank God.
when I was diagnosed.
Thank God. Are you taking
double mastectomy? I had chemo.
Okay.
And I was on Femara for like 10 years.
Right.
Done with that. So,
okay.
So I'm like 12 years out right now.
So you know what?
And I just want to stay healthy,
Yes, Donna.
I do everything I can, but talking to you, listening to you, I feel like, I can do more. You can, and you should. And when you're in, I'll introduce you to one of my favorite patients, Pam. She also she's had a double mastectomy. She's had breast cancer now for approximately 10 years. And I will tell you, she does everything she can to maintain her health. And I think you would do well with a short
short course vitamin C, some immunotherapy. We would really help you. Definitely. Come on in.
Yeah,
And-
Donna, you can make the call right now. Operators are
bless you.
waiting, so you want to make the call and make that appointment.
And
Feel
I
free to
want
do
you
that.
guys to stay safe here in Ben Salem. I have a lot of patients from there. Okay?
Thanks
God
for the
bless
call.
you.
Thanks for
That's
the call,
a
Donna.
wonderful
Good luck.
call.
Yeah.
A wonderful call.
We started the show talking about chelation, and now we're ending it because this is another situation.
Where we can use chelation
Right.
for her husband, but in addition, we can use vitamin C for her along with stuff to improve her immune system. And she's one of these patients that I love to do, and her husband, because it's the kind of thing that I have to keep her in balance.
Right.
Balance.
That's right.
So no stress, Donna.
One of the things about you in this show is that you offer hope for a lot of people.
I find, look,
because
I'm not
many of
gonna
them say,
tell-
"No, we
listen, I'm
can't do
not going to
anything."
tell you that we're going to cure you. We're not going to cure you, but we're going to improve your quality of life, and we're going to improve your outlook about your condition. There are many things that people, it's just so disheartening when a doctor says there's nothing else we can do. I understand that their hands are tied, but please do the research, folks.
Right.
Okay.
And with that, we put the wraps on another edition of Health Watch. Don't forget, operators standing by, and they'll be there after 9 o'clock. They'll be there all day. 856-489-0505. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. The website, innovativemedicalassociates.com. And don't forget our repeat of today's show tonight, 8 till 9 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Franny, a speedy recovery to our nurse, Crystal, also Jess, and our medical assistant, Kathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday, 8 till 9, Health Watch, here on Talk Radio 1210 WPHT. You take care.